Hello everyone, my name is Christine McCormick. I'm a Child Protection Advisor for Children in Armed Conflict and Fragile States. It's a first webinar on the impact of the COVID-19 pandemic on addressing recruitment and use of children. Good morning and good evening and good afternoon to everyone. Appreciate everyone who's been able to join, particularly those in Asia where it's very late. I would like to thank in particular the Global Alliance on Child Protection in Humanitarian Action for their support and cooperation in holding this webinar, and also the French language webinar that we have on Thursday. Today we have colleagues from the Philippines, from South Sudan, from Nigeria, who will be able to share some of the experiences, some of the challenges that they've had in implementing programming and advocacy of children associated with armed forces and armed groups, and to highlight ways in which they've tried to overcome them. We will also be having a Q&A session after the presentations, but I'd like to start our webinar by inviting Audrey Bollier from the Alliance to start us off. Thank you very much, Audrey.
Thank you, Christine. Hi, everyone. As Christine mentioned, my name is Audrey Bollier. I am the co-coordinator of the Alliance for Child Protection in Humanitarian Action. I would like to send a warm welcome to all our speakers and attendees today from all over the world. The Alliance is an interagency network of over 100 members working on setting standards and providing technical support. Since the outbreak of the COVID-19 pandemic, the Alliance has been responded by producing technical notes version 1 and 2, together with 10 annexes, including one on children associated with armed forces and armed groups, 26 webinars, and a series of podcasts. And you can find all those resources under the Alliance website. We have a tab named COVID-19. At the outset of the pandemic, child protection actors had begun to express concerns about COVID-19 could affect a particularly vulnerable group of boys and girls known as children associated with armed forces and armed groups, or CAAFAG. CAAFAG refers to any person below 18 years of age who is or has been recruited or used by an armed group or force in any capacity, including but not limited to children used as fighters, cooks, porters, messengers, spies, or for sexual purposes. We know that every day a child remains with an armed force or group, he or she is at risk of physical, psychological, or sexual violence, and even death. Programs that prevent recruitment, separate children from armed forces and groups, and support the reintegration process are all life-saving interventions. In May 2020, the Alliance published a document titled Key Messages and Consideration for Programming for CAAFAG during the COVID-19 pandemic. The document, which is available in English, French, Spanish, and Arabic, can be found on the Alliance website, as I mentioned earlier. This document highlights issues related to the prevention and response programs for CAAFAG in light of the wide-ranging socioeconomic impacts of the COVID-19 and restrictive or at times repressive containment measures, as well as the unique dynamic of each conflict context. Over the past few months, we have been able to learn more about how COVID-19 has impacted CAAFAG programming on the ground. And I'm very happy to be able to welcome our speakers today, who will be able to share with the consequences of COVID-19 on CAAFAG programming in their context, what challenges they had to face, and what we as a child protection community can learn from their experience. Thank you, and I wish you a very good webinar.
Thanks very much, Audrey. So we now have three short presentations looking at the three countries we mentioned. We'd like to start with Philippines, and I'd like to welcome Farid Esther and Miriam Akop to give a brief overview of some of the challenges they've experienced and promising practice that they've have seen and developed in their programming. Thank you very much.
Thank you, Christine. Good morning, good afternoon, and good evening. I'm Farid Dastir, Child Protection Specialist with UNICEF in the Philippines. I'm joined by my colleague Ruhani Baragir, Child Protection Officer, and Mariam Akub, Program Coordinator from our implementing partner, Community and Family Services International. Today we'll present how we do the follow-up support for children disengaged from MILF, Moro Islamic Liberation Front, and post-disengagement reintegration during the COVID-19 pandemic. In this presentation, we'll talk about the overview of the disengagement and reintegration program, also program adjustment in the context of COVID-19, as well as reintegration support for disengaged children and their families. To give you just a background, United Nations and MILF signed a UN Action Plan for disengagement of children that resulted in disengagement of 1,869 children back in 2016, late 2016 and 2017. And the reintegration program has been going on since then. Now, out of those children, 730 of them are now undergoing the reintegration program. The others are beyond 18 years old, or now they're adults. The difference in the Philippines in this case is because the majority of these children, they live with their parents, and their parents are themselves members of the non-state armed group. And there was no pattern of forced or formal recruitment or incumbent or separation from parents or caregivers. In most of the cases, parents' consent was present, so the children joined together with their families with the non-state armed group. In such context, the disengagement means disassociation of children from the roles they perform for and in the armed group and transition from military to a civilian life. This slide shows the different roles children were playing in the armed group. So you could see started from cooking and then to checkpoints, combatant, so many different roles as explained by Audrey. This map shows the geographical areas that children have been registered prior to the disengagement process. The green dots represent municipalities, and the shaded lights colors indicate the number of children in a given province. So all 869 children, they are coming from southern Philippines, from Mindanao areas. The UN MILF action plan was signed back in 2009, but there were a number of setbacks, although it showed the significant commitments from the MILF to end recruitment, but a number of conflicts happened and there were some setbacks. But officially, finally, the UN MILF action plan officially started in 2014 when the benchmarks of the UN action plan was endorsed by the MILF leadership. And finally, with the completion of the all benchmarks, 1,869 children released or disengaged from MILF in late 2016, early 2027. The whole process for implementation of the UNMIL action plan, as well as the lessons learned, have been documented. And it's also one of the successful implementation success stories highlighted in the 5th country report produced by the Secretary General on the Philippines. And it's available on UNICEF Philippines website. We can share link later on to the chat box also for the colleagues who are interested to learn more. And with support from UNICEF, the reintegration program has been going on since October 2017, contributed to prevention and reassociation of these children back to the armed groups and armed forces. So these are the backgrounds that I shared. So may I call upon my colleague, Mariam, from CAAFAG to share the program adjustments in the context of COVID. Thank you. Over to you, Mariam, please.
Yes, Farid, thank you so much. Good evening, good afternoon, and good morning, everyone. Yes, Farid, that's true. On the onset of the COVID-19 pandemic, we want these adolescents and youth and the children to continue in their participation on the reintegration process. So, what are the adjustments we were made during this COVID-19 pandemic? First is that the life skills and the psychosocial support session was conducted in a weekly basis, modular and guided sessions at home, last session on COVID-19 prevention. And in order for them to be aware also on information and perception on the impact of COVID-19 to their daily lives and their coping mechanism, we also let them to join new report, and then we maintained our communication with them through mobile phones, group chat, using social media accounts, and provisions of top-up mobile loads. And then also we were able to linkage them in other CSO partners through radio programming on child rights and online youth engagement activities, and also advocacy with other youth networks. Also, we were able to mobilize our Muslim religious leaders for them to deliver sermons and key messages on protection and prevention of risk of reassociation in communities. Follow-up support also, like home visits, in order to continue for some families without access to internet. But of course, serving social distancing, wearing face mask and face shields. And for those families without mobile phones, we were able to mobilize also, or we were able to depend on our parasocial workers to reach them through neighbor or immediate family members from the community. And for those children who have their access to internet or connectivity, mode of communication with them is through social media platforms, phone calls, and SMS. And then ways of reaching these children and their families are through a rented motorcycle and boats for home visits. Of course, observing proper health protocols. And then coordination also and referrals to other partners was done in order to cope up on the onset of the COVID-19 pandemic. On the reintegration support for the children, at this point of time, we were able to refer at least these 1,869 disengaged children to Ministry of Social Services and Development and Ministry of Basic and Higher Technical Education for possible assistance. And out of these 1,869 disengaged children, 186 of them is orphaned, which is also referred to Ministry of Social Welfare and Development for welfare assistance from 2020 to 2021. And then 621 of them in school already referred to MBHTE for scholarship and school supplies support to continue their education, especially in tertiary level. And then followed by another 162 families out of the 1,561 families already under validation of the MSSD for their Sagip Kabuhayan program. Another support from the government are those families from Central Mindanao. A total of 117 received vegetable seeds from MAFAR, and a family also in Mandulan, Tawi-Tawi received livelihood assistance of fishing net and accessories. All of these are this 2020 and in support to them during this COVID-19 pandemic. A total of 878 families also from Lanao, knowing that Lanao and Marawi City is one of the hotspot area of COVID-19 in Mindanao. Programs and organizations were able also to give them livelihood support, lamination machine, including printer and welding machine. No? Those pictures are among those livelihood support given to the families in Lanao. And I think that's all for our presentation from the Philippines. Thank you and more power to everyone.
Thank you
Thanks
very
very-
much, Miriam. Over to you, Christine. Thank you.
Okay, thanks very much, Miriam and Fareed, for that. I'd now like to invite Richard Talagua and Vanessa Sarova, who are our colleagues from South Sudan. Thank you.
Good morning, good afternoon, and good evening, everyone. So my name is Vanessa Sarova. I'm the Senior Protection and Gender Advisor with World Vision in South Sudan, although currently calling you remotely from home. We'll take you through a few slides and discuss the situation in South Sudan, and then I'll hand over to my colleague Richard from Save the Children to introduce himself and continue on with the presentation. So I'll start generally with the context in South Sudan, and feel free to read this at your leisure. But what I really wanted to highlight with this slide is the situation in South Sudan, particularly around the political dynamics, highlighting that it was only in February of this year that the coalition government was finally formed, following years of delays in the ongoing civil conflict beginning in 2013. Now this is a highlight, but it also scores how rampant the use of armed conflict, and particularly children in armed conflict, has been throughout the course of the civil conflict in South Sudan. Since 2018, there's been over 3,000 children that have been released from armed forces. Since the beginning of the conflict, there's been over 3,000 children that have been released. It's been in 2019 that 1,000 were released, but all of this to say that the number is generally at 19,000, and so this needs to speed up, and we need to be doing this quicker, safely, and effectively. The first case of COVID-19 was in April 2020, and that has continued to rise since then, which has also created an anti-UN and anti-NGO sentiment in the country. This has affected the overall peace and security dynamics in country, which was also highlighted in the Security General's report in June of 2020. So all of this to say that there are relevant structures for demobilization, release, family tracing, rehabilitation, and reintegration that is ongoing, with strong coordination among partners. In terms of the continuity of services, since COVID-19 reached South Sudan in April, there's been significant release of children that was originally planned that has been halted due to various restrictions. We know this, and I know that I'm certainly preaching to the choir, so to speak, in this forum, but child protection related activities are not seen as life-saving, so we did have to halt operations significantly. Between January and June, thankfully, there were 97 boys and 2 girls that were released. But all that to say, the Joint Verification Committee that's established has also experienced delays and isn't able to conduct timely activities. Family tracing and reunification work, this has also been paralyzed for both children formerly associated with armed groups as well as unaccompanied and separated children. Just to highlight how real and dangerous, frankly, this situation is that immediately prior to the outbreak, any children that were released, they somehow got stuck in Juba and were unable to travel and be reunited with caregivers because of the various travel restrictions in country, curfews, and also a halt on certain services deemed by the government at the time. Continuity of care has also been affected. So caseworker training, mentorship, this is done remotely. Having worked with caseworkers, they are honestly the pride of our program, and not being able to conduct trainings in person really has affected the quality of overall care that we're then providing to children. Much the case around the world, certainly in South Sudan, schools were closed, including a vocational training. And with children formerly associated with armed groups, the vocational training and life skills is particularly important. It offers them different options for those who may no longer be interested in school or far too many years have passed and they're looking for alternatives. So both of these options were removed from them. And then, of course, we're continuing on with one-to-one case management where we do have PPE available. And then overall disruptions on children and families. This is a socioeconomic crisis still in South Sudan. Interim care centers or families have little to no money or income or additional resources. So we are hearing of additional asks from both the centers and the families that we're working with. The push-pull of children involved in armed groups and armed conflict, we're concerned that a situation like this where there are restrictions, households aren't able to provide for their families, even more so, that girls and boys may be or feel forced to return to these armed groups and seek negative coping activities or mechanisms. Just overall, I've mentioned the impact on vocational training, and then of course with limitations in travel, the ability to follow up, provide direct case management support or one-to-one support in households, among peers with communities, etc. This has also had an impact on case management as well as mental health and psychosocial support. So I'll pause there and hand over to my colleague, Richard. Richard, over to you.
Thank you so much, Vanessa. My name is Richard Talagwa. I work with Save the Children in South Sudan, a country program as child protection technical specialist. COVID has impacted, of course, resource mobilization in country. UNICEF appeal for 2020 CAAFAG implementation was $43 million, and the 89% of this appeal is underfunded. And of course, since UNICEF funds many local NGOs as well as international child protection NGOs within South Sudan, it means that the funding for many local NGOs as well as the INGOs was affected because UNICEF was not able to realize most of the funds it had hoped to raise under its appeal. So you find that many CAAFAG programs for some of the local NGOs as well as of INGOs had to close, and meaning the services that they were providing to children associated with armed forces and armed groups were affected. Donor governments have diverted previously allocated funding to their own national COVID response or international efforts. Since COVID has affected, all countries of the world, you find that many donor governments that had pledged to support CAAFAG programs in South Sudan had to withhold the funding, suspended, so that they are able to address issues of COVID within their own countries. And this has affected funding for both UN agencies, INGOs, as well as local organizations within South Sudan, and it has directly impacted our services to children associated with armed forces and armed groups. Some organizations have had to end programming and they had budgets reduced, resulting into handover of community-based, handing over of their caseload, CAAFAG caseload to community-based organizations without any reasonable sustainability plans. In terms of adaptations, how we have been able to adapt, NGOs are taking increased leadership in CAAFAG coordination, mitigating reduced funding on UNICEF and partners, particularly for children remaining in interim care. For instance, prior to the COVID outbreak in South Sudan, we had 32 children released from armed forces around the capital, Juba, and these children were put in the interim center. But because organizations were experiencing shortage of funding, a coordination meeting was convened where, of course, partners were asked to raise resources to be able to support those children. Those children are, some of them are under, in institutional care, others are in community-based interim care, and the organizations are pulling resources to be able to support them. Virtual trainings are being held compared to with varying degrees of success. Of course, the best in our context would have been face-to-face, but because of the challenge of COVID, we are now conducting virtual trainings to ensure that services for CAAFAG and other vulnerable children are able to continue. Case management continues while observing COVID-19 SOPs. Of course, there's been COVID restrictions that have affected case management services with the restrictions on movement of case workers. But all the same, we continue in many locations, we continue to provide case management while observing COVID-19 SOPs. So that was the presentation from South Sudan. Thank you so much.
Thank you very much, Richard and Vanessa. Our third presentation is on Nigeria, and I'd like to invite Patrick Kwame, Irene Mwangi, and Christian to present. Thank you.
So good day all. With me is Irene and Chris, and we will try to be brief and present the situation in Nigeria, specifically on center and community-based reintegration, what best practices we've come across, what are the challenges and some of the lessons learned. Our outline will look specifically on the reintegration, both center and community-based reintegration and rehabilitation, and what lessons that we have drawn from this and could be applied in other contexts. So to begin with, the situation in Nigeria is such that we even before COVID, we had a challenge with the release of children from armed forces of Nigeria in the absence of an instrument formalizing this activity. So Nigeria doesn't have a handover protocol, even though we occasionally get children released from military detention. We think COVID has impacted it in a way that the numbers are no longer as we used to have. Nevertheless, with the Civilian Joint Task Force, which is more or less a civil militia working alongside Nigeria security forces, we have continued to enjoy some very good progress despite COVID. Action plan signed for the release of children is still being implemented. Over 2,000 children were released before COVID, and these children continue to enjoy some form of community-based reintegration. Another group of children that we took on some form of child protection response for was the Amalgiri children. These are children who had moved from other states and more or less in Northeast Nigeria undergoing some Quranic studies. COVID made it crucial for us to ensure that these children are repatriated into their mother states and have them reunified and with their families. I would like Chris at this point to touch a bit on center-based rehabilitation, both the challenges and the best practices. And then Irene will look at the community-based, and then I'll take over. Chris, over to you.
All right, thanks so much, Patrick, and thanks so much, everyone. The center-based COVID-19 came with its own peculiar challenges for the way we do and program and implement in the rehabilitation center for children released from administrative custody into the transit center. And being specific with these challenges, the social activities and the schedules of engagement were disrupted because COVID came with a new way of life. And lots of these social activities and schedules were planned before COVID without anticipating that there would be such a pandemic. So we needed to go back to the drawing board to readjust. And also we had this struggle with having, with the perception of the people of COVID. And these people, including both the children, the caregivers, and the service providers, we had a struggle around reality and belief. People not being quick to adhere to the COVID-19 prevention and control measures, such as the use of masks, face masks, social distancing, regular washing of hands, and all that. This also affected the social cohesion activities in the rehabilitation center. And also very, very importantly, the COVID brought this challenge of which led to limited contact with children in the rehabilitation center, because also in the rehabilitation center, one of the responsibility was also to identify specific needs of these children. So that was not, that was a little bit challenging, because when you're not expected to meet with these children and have more one-on-one discussion interactions with them, it was difficult identifying the specific needs of the children. However, the challenges, and there were also good practices, because we believe challenges also present opportunities for us to adjust and also try new ways of doing things. So looking at these challenges and also anticipating the lockdown challenges that could arise, there was a business continuity plan was developed and also thoroughly implemented, and it was a success. Also, given the fact that because in Northeast Nigeria, we had this lockdown to flatten the curve of COVID-19. So family tracing was, there were challenges with family tracing. However, discussions were made with relevant authorities and stakeholders in the response to permit focused FTR on most vulnerable children. And we received green light to actually carry those out. And also anticipating that the lockdown also was going to affect the health workers, as well as also in anticipation of possible outbreak, which we didn't pray for actually. A health clinic and an isolation center was set up within the premises of the rehabilitation center, and also an ambulance also kept within that premises for for emergency cases that would need immediate referrals to secondary facilities. And also all stakeholders, including children, including the children, as well as everyone having access to the rehabilitation center, were given thorough orientation on the prevention and control measures of COVID-19. And also, we also ensure that mechanisms were put in place to ensure daily risk mitigation, daily risk communication with approved messages for prevention and control of COVID-19 as developed by WHO in coordination with NCDC and the State Ministry of Health down here in Bono. And we also saw successes as over time people began to comply with the prevention and control measures. And lastly, every day we also ensured that children were encouraged to stay positive and they were encouraged to remain motivated. And this all we did within was to get them during the risk communication was strictly in compliance with the measures established for prevention and control. Thank you so much.
Thank you, Patrick. Thank you, Chris. So I will go through over the next few slides on first the challenges of implementing community-based reintegration amidst COVID-19. And also we'll look at how we have been able to adjust to fit the situation and the best practices as well. So one of the challenges that we have faced is the heightened or exacerbated psychological distress on already vulnerable children. This was as reported by children themselves and also as reported by the staff and the caregivers and community in general. The other challenge is social reintegration activities. They have been highly affected with the school closure, and some of our activities, social reintegration activities, involved supporting children to go back to school. So this was not possible with the school closures, and also with the physical distancing rule. We've not been able to conduct those activities as was initially planned. And then there were some emerging needs that had to be put into consideration in budgeting for them. For example, the PPEs, they were not initially something that could have been foreseen. So those were some of the challenges that we experienced. And then how we were able to adjust, we have reduced. Even up to now, we have reduced the number of participants. Most of our activities involved bringing a lot of people together. They're social cohesion activities, but to ensure that we keep our beneficiaries as well as our staff safe, we have reduced the number of participants in any given activity. And we have relied so much during this period on community-based structures. We have the child protection, community-based child protection committees, and we also have community-based case workers. So we are relying on them to facilitate most of these activities. Also, like I mentioned, some of the activities for social cohesion were supposed to take place in schools, but now with the school closure, we had to have some more dialogue with the children, the school patrons, to see how the activities can still be conducted by the same children, but outside school. And they were able to come up with very innovative ways of how they could conduct such activities. And one of such initiative was to distribute masks to the community members, as well as giving door-to-door awareness messages on COVID and peace building as well. And then we modified some of the activities we had to modify completely, like community participatory theater. This activity involved bringing a lot of people together, and we had to adjust it to modify it completely into a radio program.
All right, Irene,
thank you.
Thank you so much, Irene. Just to flag the last two slides, like Irene mentioned, community-based structures have proven to be a very good stopgap measure, especially in this particular context where lockdowns and movement restrictions were the order of the day. So this is something that we think should be used in this kind of situation because it has proven to be quite a positive strategy. We also used mobile phones and conferencing in the absence of physical and proximity to each other. Although this one worked well in some contexts, in some activities like community dialogues where you need community to be together and openly discuss issues and come up with challenges and practical solutions, it was a bit challenged in the sense that not all had access to mobile phones, and most times those communities do not have a way of even charging those phones, and so it wasn't the most effective strategy. The last is that these children in the community, in the rehabilitation centers who had been trained on some basic skills, including tailoring, dressmaking, etc., were very useful in this particular situation as they were physically involved in producing face masks for themselves and the communities. And we also engaged a range of community actors, opinion leaders, traditional leaders to also help in this particular context. Otherwise, thank you from Nigeria. Thanks, Irene, and thanks, Chris. Over to you.
Thanks very much to you, and thank you all, the panelists, for your presentations and for keeping them as pretty good to time. We've now got about half an hour, 35 minutes for some questions. So this is a question, I think, to all countries, to all panelists. You've highlighted a lot around sort of what you've been able to do, particularly through community-based interventions as regards to reintegration programming and sort of what's worked, what's not worked quite so well. I wonder if you could share a bit more about what you've been able to do, and if you've been able to do anything on prevention of recruitment. I'll ask Philippine colleagues to respond first.
Thank you, Christine, for the question. I think I'd start by saying that in the Philippines, we have been doing the prevention work, and it's something continuous, and it's not that we have stopped, and we'll continue. And the way we work, it's in the framework of peace building approach programming, improving the social cohesion, strengthening the government system to improve access to services, at all levels, especially in remote and underserved municipalities or areas. And another area that we are working with the communities and with adolescents and youth themselves, support to youth networks and providing them with the tools and platforms like YouReport to voice their concerns, to share their ideas, and to have the chance to influence decision-making of the government. And this has been very useful in coming up with the youth agenda that was recently developed with support from UNICEF and partners by Bangsamoro Youth Commission. Another area that we engage with the communities include partnership with the Muslim religious leaders to make reliable information available to parents as well as to adolescents and youth, and then to continue awareness raising in the context of COVID through radio programs and through Friday prayers where still it's going on. So in brief, we would like to improve access to services, bring opportunities for participation to adolescents and youth to become agents of change for themselves, for their communities, and also to make sure they have access to correct and reliable information about the correct narratives from Islam, from religious, and they feel belonging to their communities and contribute positively in their lives.
Thanks very much, Reid. Colleagues from Nigeria, do you have anything to add to that in relation to the work you've been able to do on prevention?
Yes. Now in Nigeria, of course, there are two main groups, Boko Haram and the CJTF, which are being listed in the SG's report for recruitment and use. With Boko Haram, there's really very little that we have been able to do because we don't have access to them. But with the CJTF, we have had a review of the action plan signed with them. We brought together all commanders and secretaries from the different LGAs in the 3 states of Northeast Nigeria, getting them to recommit to respecting the zero tolerance for recruitment and use of children. This actually happened some few weeks back, which was very positive, and it was like re-emerging and for them to reaffirm their commitment for this. And also with our community-based child protection networks, we have continued to carry out the same advocacy at the different LGAs where they're present. And so communities are also aware of the need not to encourage child recruitment. What seems to be happening in the CJTF is that there is no conscious recruitment policy of children, but the occasional use of children for menial jobs. And this is what we're trying to tackle now. Like I said initially, over 2,000 children were already separated from their ranks. The whole of last year, we did not register any fresh recruitment of children by them. However, there were occasional use of children, and this is what we're trying to get them to understand that they mean more or less the same thing, and there's no room for that. Over.
Thanks very much. And Vanessa and Richard, are there sort of practices, experiences on prevention that you can share from South Sudan?
Yeah, I think the only thing that I'll add is the importance of a multi-sectoral response. I mean, many times these children, whether they're forcibly recruited or they choose to join, it is because of a lack of resources in the household. And if we think across the ecology of the child, which if you know me, I think it's my favorite thing to speak about, there really is the importance of working with parents and caregivers as well as communities. So I met one boy, and he spoke to, yes, he was released, but he also didn't want to go home because it was an unsafe and not a healthy home environment. So he was now living on his own. Late teen, living on his own, doesn't want to be home because that's what he felt was safest for him. And as much as we did try to have conversations with the parents as well as with the boy, there was no reconciling that. So in order to prevent that, you need to think about how you can sustain the well-being and livelihood of this boy and then for other children who do return home, for their households as well. Because again, in South Sudan, the socioeconomic impacts overall because of the civil war, and certainly now because of COVID and limitations, that's hugely important and cannot be discounted. So meeting overall household needs and working with children, their parents, peers, etc., that's of significant concern to prevent child recruitment.
Thanks very much. We have a question for the Philippines. You gave some very good ways in which programming has been adapted to COVID and what's been able to continue, and thanks very much for that. What challenges did you face originally? And we've seen how you've been able to adapt your work, but were there challenges that you weren't able to address?
Yes, the most challenges actually we experience during this time of pandemic, since we adjusted on the program, mostly internet connections. That's why we muchly depend on our trained parasocial worker to reach out the children, to deliver the modules, the task in a weekly basis manner. At the same time, we were able to tap also our trained khatibs or the religious leader to help us, especially in the delivering of child protection sermon. And at the same time, here in Mindanao especially, we believe that these trained khatibs are very influential in dealing this disengaged children and their families. Thank you.
Thanks very much. We have a question from Bridget for South Sudan and Nigeria colleagues. What specific challenges have you faced in relation to family tracing and reunification, and how have you addressed these challenges?
In the context of South Sudan, we have been able to address family tracing and reunification by working, identifying partners who are present in the different locations from which the children come, to be able to link up with the families of these children. Because in the context of a suspension of restrictions on movement, it was difficult for case workers to move from one area to another. So we opted to use partners who are present in a certain location where the children come from, to be able to trace for the families of these children, and then they would link up, especially, I mean, given that some of the children got stranded up in Juba, which is the capital. So we managed to establish links, the families of these children, using partners who are present on the ground from where these children are coming. They would do the tracing, and then of course the children would communicate with their families on phone, waiting for, of course, the travel restrictions to be lifted, and then we can facilitate the movement of these children to their locations. Yeah, thank you.
Thanks very much, Richard. Patrick or Irene or Chris, do you have anything to add to that from the Nigeria experience?
I think it's pretty much the same, working with partners, especially local NGOs, and ensuring that they help with this. And the lockdown wasn't that long in Nigeria, which was also quite helpful, because at the time we had quite a lot of children in our center, but it wasn't that long, and with the support of partners, we were also able to do that.
Thanks very much. We have another question around whether we've seen an increase in recruitment during COVID. Patrick and Irene and Chris, if I can come back to you first, is this something that you have seen? I know that you've been working on monitoring reporting over the past sort of several months.
Now, our last reports don't suggest so. I wouldn't be surprised if some of this was linked to inaccessibility because of increased insecurity, but also COVID. But our reports in the last 2-3 quarters did not suggest so.
Thanks. And with colleagues from the Philippines or South Sudan, have you noticed any increase in recruitment, or again, perhaps because of access, it's not something that's been able to be picked up?
Yeah, unfortunately, I haven't, as you say, because of access, we haven't been able to mark an increase or decrease and recruitment.
Thanks very much. We've highlighted the guidance note that was developed, the key recommendations and considerations for CAAFAG programming. Given the challenges that you've had and how you've tried to address these, are there sort of further gaps or existing gaps that haven't been sort of addressed in the guidance? And what further support or recommendations would you like to receive, or do you feel are needed by implementing agencies? I'll come to the Philippines. You can answer that first.
Yes, I think the guidance and the key considerations for CAAFAG programming in the context of COVID-19 is very much useful and relevant, no, not only for UNICEF and its for UNICEF, but also with other partners, no, especially if we have to make necessary adjustments in the reintegration program that we are currently implementing in the country. It's actually set guidelines and key priority actions that we could also apply to ensure that follow-up support for children and their families are continuous, including the access to social services. Further recommendation that we have, I guess it will be very helpful as well to include some of the case studies, no, set some examples from different countries, think that we have different contexts as well, no, if you can see Philippines context is also different from Nigeria and South Sudan, based on the background that shared by our speakers. And the way that we share this guidelines, so we're working closely with we have this joint child protection and gender-based violence working group at the subnational level. And we're using this as a platform for sharing key messages, other adjustments and guidance and protocols. And we're including, there's a plan for the working group, especially that it is being co-chaired, no, by UNICEF and UNFPA for GBV, to include discussion, no, on the key messages and considerations of this CAAFAG programming during COVID-19 as one of the learning sessions, no, that we will be conducted during its regular technical working group meetings. And I guess we're receiving a lot of interest coming from members as well, because during the onset of the COVID-19 in the Philippines, we've been asking, no, from other colleagues, including New York, if they have available guidance note that they could share. And so luckily that we found it shared by the Alliance. No, so thank you very much for that.
Thank you. And colleagues from Nigeria, is there further guidance that you feel is would be useful that you haven't been able to receive so far?
I think you know, even prior to COVID, there was a challenge in donor funding, and now it's already going down even further. And so guidance along how we do very specific programming in this context. I mean, it's not the regular emergency we're used to. This is completely new, strange, and we just need to find a way to adapt to it. But if there's specific guidance on programming within the context of COVID for this particular group of children, it will be useful for us in Nigeria.
Yes, there has been guidelines produced by the child protection subsector, but also it has proved to be very important to have guidelines for specific activities. For example, we have guidelines for MHPSS. So if we could have for specific components, that would be great.
Super, thank you very much. Colleagues from South Sudan, do you feel that there is the guidance that's already been developed and the work that you've been doing within the CAAFAG working group in South Sudan, has it been sufficient, or are there other issues that you would like more guidance on, you feel that would be useful, particularly given some of the constraints that you've highlighted?
Of course, with the outbreak of COVID, the last CAAFAG working group I attended, we had just disseminated those guidelines in the CAAFAG working group. And then, of course, with the outbreak of COVID and restrictions of movement, it all affected the activities. So we really haven't had much time to operationalize these guidelines, but we found them very useful at the time of dissemination within the CAAFAG working group.
Thank you. And in a way, we have another question which can be seen as a bit of follow-up to that from Alexandra around how you've been able to adapt case management services to children within the context of COVID, and noting the restrictions that you have all highlighted, and in a way sort of linked to that, how have you been able to guarantee access to basic services specifically for this set of children who have particular situation? So go back to colleagues from South Sudan to follow on what you just said.
With regard to case management, of course, how we have been able to adapt was to use case workers, community-based case workers, to provide case management. Of course, they were being supported by the community structures, child protection mechanisms, to be able to identify cases of vulnerable children, and then they would be referred to the community-based case workers to provide case management. Technical support for the case workers was being provided by their technical people using their phone, be able to guide them on what to do at community level. So of course, yeah, case management continued being provided by community-based case workers working together with community structures and receiving support from their superiors using the phone. Management continued while following the standard operating procedures.
Yeah, I'll add just slightly from World Vision's perspective and speak very transparently that because of COVID and reduction in funding overall and diversion of funding, we actually ended our program in June of 2020. We didn't see a renewal of some existing partnerships. But all of that to say, what we were doing as part of our program was also training government seconded social workers and case supervisors to support the program. It wasn't exclusively World Vision staff. We were trying to ensure sustainability of the actual child protection system within South Sudan. So we hope that those structures have continued. And in addition to what Richard said, our work with the community-based child protection structures, their work to monitor child protection violations, that is ongoing. But again, when it comes to the one-to-one, Richard has outlined what organizations in South Sudan are doing with respect to one-to-one protective equipment, phone calls, etc. But the reality is that the advocacy point certainly is that in order to continue case management safely and respond to the needs of these children, we can't discount that there are multiple humanitarian crises in South Sudan. And so, yes, we're thinking about COVID, but we don't want to stop funding or divert activities because of this. This is still a life-saving response, and that's a key advocacy point as well, that many of these activities, case management as an example, were asked to stop because they weren't seen as life-saving. So we've made adjustments where possible, and we're seeing alleviations in country and what we're able to continue. But unfortunately, some of these activities are the first to stop or the first to go when something like this happens, not understanding the repercussions.
Thanks very much. Just to pick up a point, and after this question, I'd like to ask a colleague from Myanmar to also contribute with their experiences. But I just want to pick up a point that you made around the fact that, a number of you have commented that resources have been limited, have been squeezed as funding from donors has been diverted, and it's affected all agencies, whether an NGO or UN agency, etc. I'm interested in the advocacy that you've done and the engagement you've done with particularly authorities to ensure that services and interventions can continue, and there continues to be attention specifically on CAAFAG. Colleagues from Nigeria, you mentioned that you'd had some engagement with with the authorities, how were you able to engage with them and ensure that children were prioritised and the situation of these children was demonstrated to be necessary to support? Thank you.
Well, our work with the Ministry of Women Affairs and Social Development, the ministry in charge of children, has been very strong. The relationship looks quite strong, and they understand the need for sustainability and for them to take ownership. And so whilst we provide the technical support, they are more or less ready to carry out this work, understanding that, in fact, the onus rests primarily on them. But also our work with the Ministry of Justice, that is charged with the responsibility of working with the Civilian Joint Task Force on the non-recruitment and use of children, again, has been very, very strong. In Nigeria, civil society is also quite strong. So for instance, case management that we're talking about is more or less managed by national organizations, Gold Strong, Group Prime, and a few others. And so this is all within the context of trying to get them understand that there's a need for sustainability and the need for ownership, and that in the end, we might not have the funds to get all this going on, but then they should be able to carry out this within their regular social work in the States. So this is what is more or less happening in Northeast Nigeria with government and local counterparts.
Thanks very much. I'd like to, we've had a bit of a chat with colleagues in Myanmar who'd like to share some of their experiences. Yeah, I'm sorry if I've mispronounced your name. If you can, I can give you just a couple of minutes if you would like to share the work that has been done in Myanmar and some of the challenges and that you've experienced and how you've tried to address them. Over to you. Yes, we can hear
thank you so much. I didn't expect it to have a chance to share the Myanmar experience. Thank you so much. So in the COVID situation, we've been facing the several issues, like because of some CAAFAG is already in the work and they already have a job. But when the business owner shut down their business and they return to their community, in that moment, in that situation, several children they're facing, like community not accept them, and also business owner not willing to accept them because of they are not able to operate the daily business things. So there's no more income for them, and they're also not able to go back home, and they're stuck in the middle of that situation. So, and government also announced that not accepting any strangers, even to the monastic, the religions building. So the religions leaders also not willing or not able to accept them. So they have to stay on the streets. And then at the time, there's a curfew. Government announced a curfew, and that they are really in the very dangerous situation. So if they are found on the street within the curfew periods, they will be arrested. So in these cases, a lot of things we are facing, and we struggle to address. So at the last, if I going to make shorter of my reflection, we engage with the business owner again, and we negotiate, convince them, and then also we try to support some daily meals during this period, and also we communicate to their community leaders, and also how to say that until the government lifted all the lockdown, the situation. So after 2 or 3 months, the government released, all the restrictions, and then we arrange immediately something like to go back, to be able to go back to their communities immediately. So that kind of situation, this is one of the scenario among the a lot of other issues. So, however, like someone from the student said, this is unexpected situation. We never been experienced like that before, so we have to adapt based on that case by case issue, and also I just want to share this one, but there's a lot of other issue as well. But if I may, just one point regarding the access to the non-state actor, because of such several children are also released from the armed groups, but they are listed as a illegal association by the government of the Myanmar. So when they release the children, we cannot go and pick up, cannot do the family trees, family reunification. So this is also another challenge. So we're trying to, convince that armed groups and also the CSO, CBO based in that NGC area, although they are not trained, but however, they are aware of the child protection. So we deal with them and then to support, to assist that kind of family reunification in this very, very challenging situation. So thank you so much, and over.
Thank you so much for that additional contribution. It's very welcome to receive. We're almost at time, and I have one more question that we'd like to pose, and then a few sort of announcements before we finish. Vanessa, you had mentioned sort of the importance of advocacy, and a number of you have talked about the importance of advocacy to ensure that the work that was previously ongoing in relation to the release and reintegration of children, prevention of recruitment is able to continue, and the impact of COVID has highlighted other points for advocacy. I wonder whether, in addition to the points that have been made, whether you have sort of one or two other advocacy messages or recommendations that you would like to make. And colleagues in the Philippines, if I can come to you first.
Yeah, thanks, Christine. As mentioned already, that in the context of COVID-19, the already under-resourced child protection services affected also negatively because the resources have been diverted to COVID, and the child protection services are not considered that essential at this context. So the two key advocacy points that we'd like to highlight here is that to ensure continuity of the essential child protection services, including during the containment measures, that to make sure the services are there for children and they're part of life-saving services. The second is to ensure that government will invest sufficient resources to strengthen and expand the social services workforce, as well as the provision of child protection services with a strong focus on prevention side to make sure children are protected and prevented from association and reassociation with the armed groups. Thank you.
Great, thanks very much. And colleagues from Nigeria, Patrick, Irene, Chris, what two advocacy recommendations, in addition to those that have already been mentioned, would you like to add?
I think in addition to what Farid is mentioned, we just want advocacy around the fact that government should not take their eyes off the ball in terms of what children are going through, and that COVID is further exacerbating the already vulnerable state in which they are. And all resources should be marshaled, and the ministries in charge of social welfare and social development must be strengthened, both in terms of human and financial resources. At the state and federal level, as donor funds continue to dwindle, that states should be able to generate their own and also ensure that budget allocations for these very specific ministries are considered.
Yeah, I think down here we've tried to see how we encourage the government to take the lead, and also, like Patrick mentioned earlier, we prioritizing implementing through the Ministry of Women Affairs and Social Development, because and the Ministry of Women Affairs and Social Development also playing an instrumental, a very key part in the Borno State task force for COVID-19. So while we give them the opportunity, is for them to also ensure that they advocate
within that circle that every response and programming for in response to COVID-19 in the States captures the needs of the children. And the Commissioner for the Ministry of Women Affairs and Social Development has also been very, very vocal through support from UNICEF to also ensure that the children are not left out in the programming for CAAFAG down here in Nigeria. So we'll continue to do that. We'll continue to ensure that they take the lead, and also we'll continue to remain available to provide them with technical support, because like Patrick also said, tomorrow when we're not here, it is the onus falls on their table to carry on from where we have stopped. And then that is why we remain committed to ensuring that their capacity is built around that, and so that we can be very, very confident to say that children in this context are safe when we're not here.
Thank you so much. We're at time now, so I'd just like to make a couple of announcements and comments before we close. A couple of colleagues have asked where we can get further information, both on sort of CAAFAG responses for COVID, but also other guidances as well. If I can share my screen to the Alliance website. So there's further guidance available on COVID, an adaptation of interventions on the Alliance website. There is a Q&A box on the website as well. At the bottom there, it's called Hannah. There are a couple of questions that unfortunately we haven't been able to answer. We've run out of time now, and I do apologise for that. But we will be using that Q&A facility on the Alliance website to respond to that. I'd also like to highlight the establishment of a new CAAFAG task force within the Alliance. Let me see if I can just bring this up for you. The webpage for that is now available, so please look at that webpage for further information. It's a task force that is being co-led by Plan International and UNICEF. Oops, sorry, I've just pressed the wrong one. But there is more information on that task force on the Alliance website. The last announcement that I also wanted to highlight was a paper that is being developed, written by Plan International, on girls who've been recruited and used by armed forces and armed groups, and that is available from Plan International colleagues, and we can put a reference to that on the CAAFAG Task Force website as well. Here's the website here. Sorry to have opened the wrong page up earlier. So we're at time now. I would like to thank very much all of the presenters from Nigeria, from South Sudan, from the Philippines, for all the work you've done in preparing your presentations and giving us the information you have. I appreciate very much for Farid and other colleagues from the Philippines that it is very late there. So thank you very much to do this at the end of your working day. There will be a recording of the webinar shared through by the Alliance shortly. But following all of this, I'd like to thank everybody for calling and participating. I hope you have found it informative and useful. Thank you very much.